Do you want to set us up?
Nope.
What's up, everybody? I'm Scott, physical therapist, performance coach here at PhysioFIT.
Michael Hernandez, same title.
We're going to talk to you a little bit about what we see in the clinic with deadlifting. Probably the top two things that we see that cause dysfunction and pain in most of our athletes and patients.
Yeah, kind of four things, two from each of us. A lot of same but different. I think one thing we see online a lot is like, here's what you need to see. Here's the one fix. And I think for us, it's always like all roads lead to Rome. You need a big, robust toolbox to figure out, does this cue work for someone? Is it coming from this issue? So we just kind of want to give our perspective on kind of a couple things that we tend to see that often end up leading to the same issues or stemming from the same issues.
So kind of like the two main things I see with people with back pain with deadlifting. The first one is their setup.
Right.
Setup kind of looks terrible. So really what I want to see, let's go get your setup. Kind of look like you haven't deadlifted before. There you go. All right. So generally I want to see your butt up, shins vertical. Can you feel tension?
Oh yeah.
Where do you feel the tension's at?
In the hamstrings.
And?
For me, it's in this position. For me, it's all hammy.
Okay, cool.
Yeah.
Sometimes people's hammy and butt. So shins vertical, tension in the hamstrings, tension in the butt, flat back. So the number one thing I see is just like poor positioning from the ground up. Second thing I see, this is usually, you can relax. If somebody does have good technique from the get-go, and they're cycling the barbell in like a Metcon or any sort of conditioning, and this isn't necessarily just from like CrossFitters. We see people from all over. All over. Yeah, not necessarily just one exercise domain. But they'll come in, they'll have good technique. When you look at one, you'll add some load, still look pretty good. And then you get them on the barbell and you watch them cycle. And we made a post the other day, I think Monday or something, about Main syndrome. And this is thoracolumbar junction dysfunction. So that's kind of where your thoracic spine here meets up with your lumbar spine. You get too much like little micro movements here, and it can cause some irritation, give you some weird symptoms. You can check out that blog post or that Instagram post of what we did. So Michael, I want you to cycle, let's cycle like 5. I want to cycle let's cycle 5 good reps.
Okay.
Good. And you see Michael kind of starts and finishes at the same spot every time. Now, when you see somebody, you're in a Metcon, you're in a longer workout, or you're just like more volume than you're used to doing, you'll see people either try to reach for the ground or their erectors, so their back muscles just end up getting, these guys just end up getting fatigued, and they can't hold that like midline position the entire time. So give me 5, and I kind of want you to try to hinge right at that TL junction.
Give her a shot. All right.
So let's do 5. Good. There you go. That was it. So just that little hinge, and it's not like a big hinge. You're generally not seeing somebody give me like a really bad like rounded back. It's generally not that, although it can be. But another thing, if this is something that happens to you, you can look in the mirror or have your significant other or friend or your business partner take a look at your erectors, and I want you to turn around for me. So you'll see these guys. They'll be really, really big and defined right here, and that's where the dysfunction ends up happening. You see that all the time. No muscle, lots of muscle. What about you? What do you see?
So kind of some things that I see are poor ability to keep that bar close to you, right? So losing contact with the bar. So if you go ahead and get set up on the bar here, nice deadlift position. We're super excited about it. He pulls to the top. And then ideally we want to see this, and watch, kind of pay attention to that bar in relation to his legs the entire time. Go ahead and go to the bottom. Perfect. So when we see this dysfunction, or kind of what leads into what Scott was talking about, is when we lose connection with the bar. So that being that bar kind of getting away from us. It can come from a multitude of things, but it looks like this. Go ahead and pick it up. Nice. And as we come down, that bar just leaves our body. Good, back to the top. Show me one more of those. And so what we'll see is this all the time. As that bar shifts forward, that stress shifts up his back. You can almost think, go ahead and relax. You can almost think of it as just like a sliding scale. The further that bar goes out, the more the stress moves up the back. And this is where people, they start deadlifting, they have that kind of mid-back pain. These two things, the hinging through the TL junction and losing connection with the barbell, tend to go hand in hand. Because they'll have that pain, and it's like, well, is it a chicken or the egg, right? Are they losing contact because they're hinging, or are they hinging because they're losing contact and lose that stability through that TL junction?
So do you think like setup is an issue for that, or is that just like fatigue, or what is that?
I mean, it's kind of a and, right?
Yeah.
Yes. So for me, I am a pretty big stickler with setup, kind of like you are.
You more than I.
We have different nuances for sure. But for me, if we start in a bad position, it's infinitely easier to keep a good position than to find one if you start in a bad one. So kind of I'll demonstrate this. Like all the time you look in the gym, watch people deadlift, and they just kind of drop down to the bar. And then from here, their goal is, okay, now I need to find myself a good position and pull myself into position. Whereas if we kind of start from the top, pretend I already have that bar, and I just kind of head down to it, all I have to do is grab the bar. There's no adjustment needed other than I'm going to brace and pull.
So do you think that's an experience thing? Because I know I do that. Your first one, I know you give me a hard time for
I mean,
that.
I think it can be.
Okay.
But this is where, do you have back pain when you deadlift?
I don't.
So we probably don't have to worry about it, right?
Sure.
But if someone comes in, they do have back pain when they deadlift, or they're noticing dysfunction throughout a Metcon or something like that,
So
look at your setup.
Okay, so it sounds like if you have back pain, you should probably start there. Or maybe if you're a beginner, that's a good way to just like start your process of lifting.
Definitely if you're a beginner, right? I mean, I have a big golf obsession right now. So for me, it comes down to like
Correct.
process, right? Everything is repeatability. So for me, when I teach deadlifting, it always comes down to what are your landmarks, right? When I look down at the bar in my starting position, I have the same bar position passing over my feet. Okay. There's the same width from the knurling to my feet. So I know every single time I step up to the bar, I am in the sagittal plane, equidistant to the bar, and in the frontal plane. Okay. So then it just sets you up for success, right? Like, are you repeatable in your deadlift setup? Because if you're not, as we talk more about deadlifting, there's a million things that can happen. Yeah. And they can all come from one thing or many things. Okay. So if you eliminate variables, you'll be in a better spot.
So the second thing.
Yeah. So the second thing I often see, or at least what my eye is drawn to, especially in the clinic when I see people deadlifting or say they're weightlifters and have back pain, is not utilizing a good hip hinge, but squatting your deadlift. So go ahead and get set up and kind of what you talked about, that ideal, more vertical shin, tension to the hamstrings, nice flat back. And then what people will often do, usually they can get set up often in a good position. So go ahead and pull one rep off the ground. And then they get caught not utilizing that same hip hinge. They don't get their butt back towards the wall. Instead of going back, it goes down. Show me that. And so we end here, and instantly what you see, knees come forward, so we have a less than perpendicular angle. He's still, and this is what gets tricky, is you can look and it's a relatively decent position, but now his hips are down. But if we push knees back, hips come up, we now get stretch in the hamstrings, yes?
Yeah, I was definitely feeling it in the quads there. I was shaking
stretching the hamstrings, and go ahead and cycle kind of 5 of those squatty deadlifts for me.
So I got back pain.
Yeah. Ooh. And then, so if you see, I know, sorry. So if we see this, if you keep your eye right here, there's just a little kind of that hinge that Scott was talking about. So this is kind of comes down to, you know, where does the coach's eye go? What are we looking at? Because often so many of these things marry and go hand in hand, and we're human beings, so very rarely is one thing happening at a time. But when we look at this, it's kind of, what are different perspectives that different coaches...
My heart's pounding.
Sorry, buddy. 2 different coaches are seeing, but it can lead to multiple things or the same thing, different causes. And so this is why we kind of need to develop a really robust toolkit and eye to kind of see what is causing something or what is coming along with something, right? It's not always a or, but an and.
So question for you. CrossFit level 1. How do they teach deadlift?
It's been a while since I was in there, but I think they tend to get a bit more squatty, understanding that cleans are a big part of CrossFit too. So it ends up being a more clean style deadlift, which isn't wrong, but...
So do you, not to cut you off, but if somebody comes in and they have a squatty deadlift, do you kind of differentiate the two between like a clean deadlift or like just a regular conventional deadlift that you're cycling?
Yeah,
How do you do that?
I always tend to like think about like the context, like what does the workout require? And then also like, why are you here, right? Like
Sure.
if you come to me, you have back pain and you do a squatty deadlift, while some people can get away with it, if your goal is to build a more robust, strong deadlift, squatting, it's going to be the least efficient way to get you there.
Sure.
So
it's context dependent.
Context dependent. Most
Right.
things are, right? And then it's just delineating when should you use which.
Sure.
And do you have like the mobility, the stability to even manage a squatty deadlift, because it requires a lot more from you in that kind of torso trunk area to avoid that small hinge that you see and then getting a giant mid back and a painful TL junction.
Right. So put a bow on this for us. 2 things that we can do to avoid this TL junction pain or this like lumbar spine pain.
Yeah, when it comes to like my perspective on things, I love to see coming from you, kind of something you pointed out, I want to see that good setup initially, utilizing that proper hip hinge, which will take care of that squatty deadlift,
Sure.
and then keeping good connection with the bar. And a lot of that comes through upper mid-back lat engagement, pulling that bar into you and maintaining that position, because the further the bar gets away from you, the higher the stress goes in your back.
There you have it.
Deadlift.
See, that was good.
Cool.